Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive the appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I want to introduce you to Dr. Sasha Blaskovich, who works with X-ray and motion to help explain and solve uncommon neck and head problems.
Well, my initial personal whiplash led me to it. I was living with my whiplash for about 7 years before I discovered that the technology existed.
The IT he's talking about is X-ray fluoroscopy, an extraordinary diagnostic tool that generates a picture from X-ray of the neck. It's a combination of traditional fluoroscopy and X-ray technology.
Well, there's a lot of people walking around with 10, 15, 20 years of chronic headaches, chronic neck pain that MRIs have not shown what's wrong with them, CT scans have not shown what's wrong with them, because their anatomy is perfectly fine as far as the bones. They have the same number of bones that you and I do. They get misplaced once they start moving, and once they start moving, that's when the nerves get pinched off and function starts to decrease, and that's where our symptoms come from. So being able to diagnose somebody in those particular motions that are causing these problems is essential.
So how does it work? What exactly does this type of scan reveal, and how does it affect diagnosis?
Basically, we take them through all the possible ranges of motion that their neck can do, so front, back, side to side, rotation. And based on that information, we can see if two adjacent bones are moving excessively relative to the others, A, and B, the two abnormally moving bones. What I do is actually measure them. I have a millimeter scale that I use and software that I use to be able to actually grade and measure how far they're moving.
Motion X-ray is an extremely important diagnostic tool and can even be useful prior to injury.
If they're not injured, this is something that is of essence to them, because statistics will show that 20% of the population will get into a car accident at some point in the time. Mm-hmm. And for people to know that having a baseline scan prior to an injury is essential to battling that injury legally.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow with better health outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.